Okay, everybody. So this is the completion of Tuesday's morning lecture with regards to ears, eyes, nose, and throat. So this is the last portion, the last few slides that we did not get through in class that I wanted to make sure that we did talk about for you. So let's talk about the mouth, the nose, and the throat. So epistaxis we do need to talk about. It is basically a nosebleed, but it is really common in school-age children and especially, believe it or not, in school-age boys. And it's a nosebleed that is caused either by a foreign object that they have put in their nose or just really from good old picking of the nose. Any airway or any nasal passage that is a little more dry. So whether it's due to a very dry home or allergies or something that may dry those passages out, it certainly increases the risk of a bleed. Generally, epistaxis occurs on one side. So that on both sides is more indicative of something worse. So one-sided epistaxis is normal. And treatment is really important for you to know because many times people treat it improperly and we as nurses want to make sure people understand that. So we want them to sit upright, but we want them to tilt their head slightly forward. That prevents the blood from dripping down the back of their throats, which then they could vomit later. So tilt the head slightly forward. And what you want to do is squeeze the nares just below the nasal bone. So not the nares, but squeeze just below the nasal bone above the nares. And you leaning slightly forward in an upright position for about 10 to 15 minutes. That is what will stop the bleeding. If it does not stop, then certainly ER treatment, some treatment that will cause a spray that will cause a vasoconstriction of those little blood vessels is the treatment. And if we have a chronic nose bleeder, then we may cauterize some of those tiny vessels. But remember, sitting upright with the head slightly tilted and pressure just below the nasal bone, but not totally closing off the nares. So pharyngitis or nasopharyngitis, excuse me, is a URI, an upper respiratory infection. It's an inflammation of the nose and throat, a very common thing that we see in children. The clinical manifestations really are as you see there. They may have enlarged tonsils, a sore throat, and clear nasal drainage. Anything that is clear is a little more benign. So treatment, well, we will often use our normal saline nose drops. That thins secretions. It's really helpful for infants. And then we can use those bulb syringes to remove those secretions, but thinning them first makes that excessively easier. Humidification in any room with a cool mist humidifier is really helpful because it will thin those secretions as well. Decongestants over the counter do not work as well as we would want them to, and we really try to avoid them in young children. But we should not be using, if the prescribed by the healthcare provider, should not be used for more than 4 or 5 days. If it's more than that, you need to contact your healthcare provider. But we do say, as you see there, anybody less than 2 years of age, please do not use over-the-counter preparations unless under the supervision of a healthcare professional. But again, one of the most common, nasal or normal saline drops. Very effective. Pharyngitis is an acute infection primarily in the pharynx and can include the tonsils. And you see a picture there, you can see the white spots. This is strep throat, basically. It's most commonly caused by strep, so most of us refer to pharyngitis as strep throat. Sore throat, low-grade fever, and that purulent drainage with those white patches. May not always see a white patch as I've written there, but most cases do have that white patch. A throat culture is how we manage that and diagnose that, and then we treat it obviously with a penicillin. So the last thing here is tonsillitis and adenoiditis, really very common pediatric disorder as well. And we talked about this a little bit as potentially a cause for a sleep apnea in children. So your tonsils, tonsillitis is an infection or an inflammation of the tonsils, and that's the palatine tonsils. Adenoiditis is an infection of the pharyngeal tonsils, and that's lymphatic tissue or the adenoids. All right, so you can have one or the other or both, often caused by viruses or bacteria, just like any other type of illness that we've talked about. So children that will have a tonsillitis will have frequent throat infections, and they may have difficulty breathing, as we've seen that stridor or that obstructive sleep apnea, with some swallowing difficulties. They have very red tonsils, and their cervical lymph nodes may also be enlarged, because if you think of the lymph nodes that are near that area. Clinical manifestations of adenoiditis are nasal stuffiness, and discharge that occurs with a postnasally kind of drip. So you may hear them kind of clearing their throats an awful lot. And that combined, often when you think about it, if that's what each of those are, many of these kids have both of those manifestations. And so it can be a really difficult thing, and a lot of respiratory distress can develop as a result of this. So treatment is similar to how we treat pharyngitis in terms of that humidification, thinning of secretions, etc. But we may actually do surgery to remove tonsils and adenoids, especially if we are having that sleep apnea or chronic tonsillitis or adenoiditis. For nursing considerations, here's what I want us to really focus on. Post-surgery, these children are a significant bleeding risk. So, what we have to think about is when we remove the tonsils, we're creating an area that now needs to scab or clot over. And any irritation to that area can cause an increased bleed risk in these kids. So what we teach them post-op and how we manage them is vitally important. So bleeding risk is greatest in the first 24 hours of surgery. And then about 7 to 10 days out, that becomes an additional risk as that scar has developed over that site where we removed the tonsils. So the classic sign of bleeding in a tonsillectomy site is increased swallowing. NCLEX loves this. Increased swallowing is a classic sign of tonsillectomy post-op bleed. And that coupled with respiratory distress is an even more classic sign, all right? So what do we do to prevent that bleeding? One, very soft foods, nothing that's hard or sharp. So potato chips, Tostitos, toast, things like that that can cause a scratching to that area makes sense. And we even want them to know that as they go out and go home again, because most of these kids are not here for more than 24 hours with us. Many of them are discharged within 24 hours. So we're doing a lot of this teaching, and parents need to know you may not bleed when you're right here, but there is that risk when you go home as well. And so we want to make sure that they are getting that teaching about the proper foods to eat. In the early stages, we do give cool liquids. We do put ice collars on that will cause that vasoconstriction in the area as well, which is really helpful to stave off bleeding. We do want to limit crying, which can be really difficult depending on the age of the child, but that crying causes irritation to that same area and can cause bleeding. So we want to watch that as well. So it can be a little bit dicey managing these kids in that first initial post-op time frame. And we want to do everything we can to increase comfort in the kids and to decrease the potential for bleed, cause vasoconstriction, and then as we send them home, really watch to avoid any sharp foods. One last thing in management of this, we need to watch dairy products as well. Oftentimes we think of, oh, we can give ice cream and milkshakes, but if you think about it, whenever you have milk, dairy products, ice cream, it increases mucus production naturally in many people. So what we're doing then is increasing mucus production where the child may need to clear their throat or swallow more, and it may cause, that clearing may cause a little bit more irritation to the site. So we really want more cool liquids, no carbonated liquids, cool liquids on that site, ice collars, limited crying, and soft foods.